Hello, my name's Jenna Quinn. I'm CEO and co-founder of Perfecting Peds. I am most importantly a mom to 3 little girls, and I am also a pediatric pharmacist and have been for the past 12 years. Perfecting Peds is a company that does comprehensive medication management by pediatric pharmacists in a virtual fashion for medically complex children. Over a decade of working in the hospital at regional and local hospitals in the Philadelphia area, there was this reoccurring theme that I was constantly intervening on a child's chronic meds. So in 2023, the USP Medication Error Report reported that 31% of prescriptions that are written for children contain an error. It's really astounding because this is a very under-recognized, under-talked about problem in the United States, but it's a massive issue that needs to be addressed, and that's what our mission is through Perfecting Peds.
One of the great things about Perfecting Peds and what they have done for us as a family is to really look at all of the medications and supplements that my kids are on. They actually helped to figure out that one of the supplements that I do give the kids was given too close to one of their medications that actually is required for them to stay alive. That's kind of needs to be given on a schedule. Not a single person had ever brought up the fact that the medication given too close to that supplement, which was in essence making that medication less effective.
Our children need upward of 12 to 13 subspecialists. All these subspecialists are practicing in silos. And when they practice in silos, they're just worrying about, I'm gonna prescribe this medication for this disease state, but they're not looking at, is that actually work well for the patient with all the other medications that they're on?
One of the most helpful things that one of our Perfecting Peds pharmacists did for us is that I had been trying to get a specific prescription filled for our youngest for probably a few months, and we'd been going back and forth with the pharmacy, and they told me that they were not able to fill it. And the moment that we started working with Mary with Perfecting Peds, she resolved the situation within 2 days. She found a different pharmacy who could fill it immediately. I no longer had this massive thing on my to-do list that was taking up my time and my emotional energy going back and forth with insurance and things like that. She solved it immediately.
The caregiver is always our first and foremost and most important part of the process, or the patient, depending, since we see up to 24 years of age. And we have a really unique 13-step way that we essentially work up this patient. And it's not medication focused, it's actually family focused and patient focused. And we give that personalized touch.
When I first started with Perfecting Peds and met with Jenna, so right from the bat, she shared her story, she got my trust, we were able to connect on a personal level before we even were able to connect on a professional level. Having Perfecting Peds manage the standard care of our medications for Hazel should definitely be the standard for all complex kids and families, as they just make such a huge difference in how we're treating our child and how we're doing everything we can to improve their quality of life.
Perfecting Peds helps save on the cost of care, especially with health insurance companies, as it can manage a lot of things on the outpatient basis. You know, they're talking with the providers about negative outcomes that are happening and managing them on an outpatient basis and communicating that with different care teams rather than needing to go into the ER to have that kind of care conference. We're doing that on the outpatient basis, which saves health insurance and families a lot of money.
We also are extremely accessible to these parents, so they can call us, they can text us. We also have technology that triggers if the child has a new medication or has been admitted somewhere, so that we can proactively contact the caregiver and the patient and make sure that we're identifying up front, is the medications that they're adding safe? Is there any way that we can help?
None right now is my daughter. She have none seizures right now. I'm happy for her because she takes some medicine, they scrub it. That's why I'm happy for her. And my son, before and now, he's much better.
So a lot of times what happens is you have your doctor just write out for a liquid or a pill, and they don't ask, does your child swallow pills or do they have a taste preference? All these things, especially as you work with mental health and behavioral health, really come into play of whether the caregiver or patient are actually take the med. So that's really a very high level of all the things that we're thinking of when we're taking care of these children.
It's like having a reference in my back pocket. If something happens, I can send one of them an email, they get back to me. They're giving me ideas, you know, like one of the biggest things was trying to get this iPad app to help with focus and ADHD I would have never known that, spending 7 months in the hospital looking up every single thing that went wrong with Jackson and trying to understand all the stuff they were doing to him is more overwhelming than I've probably ever been in my life. And I wish I had Perfecting Peds as a backup during that time.
Currently with Perfecting Peds, my audacious goal is to get to at least 1 million children in 5 years. So the more children that we have under our care, the more profound impact we're going to have, not only on the health system, but provide that extra layer of support and safety net for as many children as possible.
Thank you for protecting peds.